Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video we're going to be talking about hypovolemic shock. Hypovolemic shock. And so we've talked about hypovolemic shock before, but we'll go over it again. This is your body's response. Your body's response to basically having not enough blood. And so usually this is caused by hemorrhage. In our case, it would be caused by postpartum hemorrhage, but it can be caused by other things. We won't talk about those. We'll focus on postpartum hemorrhage. But if you've lost a lot of blood because you're bleeding, because you're hemorrhaging, you would maybe get to the point of reaching hypovolemic shock. And so we talked about postpartum hemorrhage being more than 500 mils of blood lost, and this would constitute hypovolemic shock. So you would start to go into hypovolemic shock in postpartum hemorrhage. Okay, so let's first talk about the physiologic response with hypovolemic shock. So in red here we have kind of a cross-section of one of your arteries, and then in blue we would have a cross-section kind of one of your veins. And when your body loses a lot of blood, all of your arteries and veins will start to vasoconstrict, and we've talked about vasoconstriction in another video, but your arteries and veins will get smaller. The arteries and veins in your bodies will contract, making less room for the blood to flow. And this keeps your blood pressure high enough while you don't have enough blood. So you can imagine if you don't have enough volume of blood, the blood has less volume it needs to take up if the artery and veins get smaller, get more constricted. But what your body does to compensate for this, what your body does to make this small amount of blood last as long as it does, is it starts to cut off the blood flow to your extremities. So your extremities would be your arms and your legs, and your body is really just trying to keep you alive. So it keeps the blood more focused on your vital organs like your heart and your lungs and your brain to try to keep you alive. And so your hands and legs and feet, they'll start getting kind of less blood flow to keep all of the blood in the parts of your body that keep you alive. Okay, so next I wanted to talk about the different classes of hypovolemic shock. And they range from class 1 to class 4, and this has been outlined by advanced trauma life support. So they just made these different cutoffs, these arbitrary cutoffs. They don't necessarily mean anything, but they allow us to kind of characterize the different degrees or the different levels of hypovolemic shock. And so class 4 would be our worst case scenario of hypovolemic shock. This is kind of you're close to death. Class 4 is really bad. And class 1 would be the most minor case of hypovolemic shock. And to be clear, any amount of hypovolemic shock is an emergency. Class 1 would be blood loss of less than 15% of your total blood volume. So the average blood volume of a person is about 5 liters. So this is approximate of blood in a person. And so 15% would be a blood loss of approximately less than 750 milliliters. And then class 2 would be 15 to 30% of someone's total blood volume. And so this would be 750 mils to as much as 1.5 liters of blood lost. Class 3, now we're looking at 30 to 40% of someone's blood volume lost. And so this would be 1.5 to 2 liters of their blood lost. So this is almost half of your blood lost, and you would be in class 3. Class 4 would be over 40%, so anything over approximately 2 liters of blood lost, and again, this is almost half of your blood loss, and you would be considered class 4. This would be extremely bad. And so we talked about how hypovolemic shock is not having enough blood flowing through your body. And so you can kind of imagine how your body might respond to this. And so your heart rate is going to be kind of normal in class 1, so less than 100 beats per minute, BPM for beats per minute. In class 2, your heart rate's going to start to go up to over 100 beats per minute. In class 3, you'll see it go up even more to 120 beats per minute or more, over 120 beats per minute. And then in class 4, you'll see your heart rate go up all the way past 140 beats per minute. And again, hopefully this should make sense. You don't have enough hemoglobin carrying oxygen to all of the organs of your body. And so your heart rate's going to start increasing in how quickly it beats to push that small volume of blood around your body more quickly so that your organs can get oxygen. For blood pressure, this one, I won't give specific numbers, but in class 1 to 2, your blood pressure is still normal, and we talked about vasoconstriction, and so your body is actually trying to maintain your blood pressure by vasoconstricting to keep your blood pressure normal. And so in class 1 and 2, that vasoconstriction is working to keep your blood pressure up, but in class 3 and 4, you've lost so much blood that your blood pressure will start to decrease because the vasoconstriction just can't do enough to hold up the blood pressure in your system. And so the respiratory rate in conjunction with this heart rate increase should also be a bit intuitive. So in class 1, your respiratory rate might be a little elevated, 14 to 20 breaths per minute. So this is how many breaths you take in a minute. So 14 to 20 breaths in and out. In class 2, that will increase to 20 to 30 breaths per minute. In class 4, that jumps to 30 to 40 breaths per minute. And then in class 4, there's a little bit of overlap, but it's over 35 breaths per minute. So there's a little bit of overlap with class 3. And again, this should hopefully make intuitive sense. As your blood volume drops, again, you don't have enough hemoglobin to carry all that oxygen. And so your heart's going to start beating more quickly, and you're going to start breathing more quickly to oxygenate that small amount of hemoglobin, that small amount of blood in your body. And your heart rate's going to pump faster to move that small volume of blood around your body to get all of your vital organs enough oxygen. So these are both to get organs oxygen with not enough blood. So it's not important that you memorize this chart or anything like that, but it's more just to understand how your body copes with this loss of blood and how it vasoconstricts to kind of keep your blood pressure up. Your heart rate starts to increase to try to get that small volume of blood moving around your body, and how your breaths start increasing. Your respiratory rate starts increasing to oxygenate that small amount of blood that you have left. Okay, so the last thing that I wanted to talk about was the treatment of hypovolemic shock. And so the treatment, you might imagine, is pretty straightforward. You'll want to start a large bore IV. So start large IV so that you can give this patient a lot of volume of fluid. So you can give fluid, so this could be anything like normal saline or Ringer's lactate. I believe normal saline is more common now. You can give whole blood as well, or packed red blood cells. So red blood cells are RBCs for red blood cells. Again, they don't have enough hemoglobin, they don't have enough red blood cells because they've lost all of them. That you can give this red blood cells to kind of replenish some of those red blood cells back. You may also choose to give fresh frozen plasma or platelets, depending on the cause of the bleeding. For example, if they do show signs of DIC, then you'd want to give back their clotting factors. And so all of these treatment options are really just trying to give your body enough fluid, enough volume to pump enough blood through your body and keep your blood pressure up and deliver enough oxygen to all of your organs. Other than in the case of DIC or issues with clotting, these treatments don't necessarily stop the problem. And so if you are having postpartum hemorrhage, you still have to treat whatever's causing that postpartum hemorrhage. All of these are just going to delay the bleeding from killing the person. You still have to solve the underlying issue. So this has been a long video, but hopefully this makes sense on kind of all of the important points of hypovolemic shock.